You are listening to Part 84 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Thank you so much. I was really amazed last week that we were able to get through such a lot of information about mammograms so quickly, and to really put into sharp contrast the topic that I explored in my book, Breast Cancer, Breast Health, The Wise Woman Way, which is still there in that book, which is mammograms, who needs them? And basically what we're finding is nobody really needs a mammogram as a screening tool. There are a lot of new things that are going on when it comes to breast cancer, but the value of mammography is clearer and clearer that it's not helping the decline of breast cancer. In fact, it appears to be other things. The medical profession likes to say, "Oh, look at how many women are surviving now," but saying that mammography is doing that turns out to be really not right. Mammography reveals only 50% of all breast cancers, according to a major study. And 50% of breast cancers are found by women themselves. What we don't think is a good idea is a very detailed breast exam where you worry about every lump, says Laura Esserman, MD, of the University of California, San Francisco School of Medicine. When the U.S. Preventative Services Task Force suggested that breast self-exams weren't very useful, that's the kind they were talking about. But a quick exam, a 30-second exam every month or every couple of months, in which you just monitor your breast for changes, that's really important. As important or more important than a mammogram. Ductal carcinoma in situ was certainly one of the kinds of cancer that I speak about in my book, Breast Cancer, Breast Health, The Wise Woman Way. And I took the, according to some people, rather outrageous position that ductal carcinoma in situ is not actually breast cancer and should not actually be treated. And it is interesting to me that this is now often diagnosed as stage 0 cancer, and more and more the medical profession is understanding that it should not be treated. So what about thermography, women say? How about thermography? Thermography, that should do it right? Not necessarily. We would love to have really good evidence that thermography is useful, but it's not. The women who I've met who are doing thermography, who own the machines, who are really pushing it, suggest that it is really a substitute for mammography, because the thermogram, which uses infrared cameras to detect temperature changes in the breast, rely on the fact that cancer tissue generally has a higher temperature than normal tissue because it has a richer blood supply and a higher metabolic rate. So hot spots in the breast on a mammogram should be cancer. However, certainly women who have talked to me with breast infections who've had a thermogram, I've had a very difficult time of it. One woman in particular had been scheduled for a thermogram because she didn't want to do a mammogram because she was breastfeeding. And she went in and she said to the practitioner, who again owned the imaging equipment, this breast has some infection in it and it's going to show up hot. And the woman called her afterward and, as my student put it, was screaming at her that she was going to die of breast cancer if she didn't have her breast removed immediately because the thermogram showed so much heat in her breast. And she said to her, "I told you I had a breast infection. You are not paying any attention at all." Thermography was introduced about 50 years ago as a potential competitor to mammography. But the Breast Cancer Detection Demonstration Project found that mammography could detect cancer when present about 92% of the time, and thermography only found it about 42% of the time. So while thermography can find cancer, it's leaving lots and lots of cancer in the wake. Worse yet, thermography falsely identifies cancer 25% of the time. Now, again, there are false positives with mammograms. We're not saying that mammograms are blameless here. In a recent study, I love this, in a recent study which examined 126 breasts, and I wondered, was that 63 women or was that 123 women? It's just kind of an odd way to put it, isn't it? Of which 20 were ultimately diagnosed with cancer. And again, is it 20 women or 20 breasts were ultimately diagnosed with cancer? Thermography identified only 5 as cancerous, giving it a sensitivity of 25%, and the same patient's mammography had a sensitivity rate of 84%. Hey, nobody is saying that mammography does not have shortcomings. It does. It has shortcomings. It's uncomfortable. It can be wildly uncomfortable for some women. It uses radiation. It misses breast cancer. And it misidentifies normal tissue as cancerous. And digital mammography, it can make it even worse. But unfortunately, thermography is just not the answer for general screening, and it's not covered by insurance either. Doesn't mean, again, that thermography couldn't be used if there is a specific suspicion and the woman did not want to do a radiation procedure, a mammogram. Mostly what we are talking about here is we are talking about the effects of screening tests and whether or not the risk of the screening test is put down by the benefit of it. And over again, I think we have seen very, very clearly that for mammograms, the risk far outweighs the benefit. But mammograms are not the only X-rays. Since 1980, CT scans, which use X-rays, have grown from 3 million a year to 80 million a year. And recent research has found that a third of them serve no purpose. At this point, about 2% of all future cancers in the United States, that's about 29,000 cases of cancer and 15,000 deaths per year, will be caused by CT scans. Shall I say that again? CT scans are going to cause 2% of all future cancers in the United States, which will annually be 15,000 deaths from 30,000 cases of cancer caused by computer tomography scans, CT scans. Doctors order tests because they don't have time to keep up with the research, because they're worried about malpractice, because they have financial incentives, and because patients insist on them. Don't be the patient who insists on the test. Be the patient who says, no way, I'm not getting it. Consumer Reports on Health has a head-to-toe advice for when CT scans and X-rays are needed and when they're not. You have a severe headache and you're really worried that you might have a brain tumor, and your doctor says, let's do a CT scan just say no. If you have an abnormal neurological exam or your doctor can't figure out what your headache is, maybe, but MRI is far better, and an MRI does not expose you to radiation. You have just had a head injury. Ooh, we have been taking head injuries ever so much more scary. The number of emergency room visits for head injuries in young children has doubled in the past 10 years. And those children are being sent for CT scans. But most of those scans simply are useless, says the American Academy of Pediatrics. And remember, children are far more sensitive to the effects of radiation. If you've had a car crash, if you have fallen off a moving bike without a helmet, if you have had a serious accident, or if you have worrisome symptoms such as confusion, unconsciousness, weakness, tingling in one side of the body, loss of hearing or vision, hey, a CT scan could help. But if it's just, let's check and see if everything's okay, just say no. You have a lingering nasal congestion, or is it a sinus infection? Your doctor says, let's figure it out by doing a CT scan. You tell your doctor, a simple nasal smear is all that's required. I'm saying no. Lots of ads are pitching CT scans for lung cancer screening, and it would be great if there was a safe, effective way to catch lung cancer early, but research shows that CT scans are worthless unless you have a very high lung cancer risk. In fact, CT scans for lung cancer screening only make sense if you're a current or former smoker between the ages of 55 and 80 who smoked the equivalent of a pack a day for 30 years. Mammograms don't expose women to that much more radiation than a chest X-ray, but some doctors are recommending them far more often than necessary or encouraging women who are too young, and this is needlessly exposing women to radiation. Just say no if you are younger than 50 or older than 74. CT scans can assess the risk of heart disease by measuring the buildup of calcium in the carotid arteries. They can even do an angiography there, and doctors say, well, it can help us decide how to treat the patient, but we're suggesting that you just say no because the test exposes you to a lot of radiation, unless, of course, the doctor strongly suggests of pulmonary embolism, which could be potentially fatal. Now, the risk-to-benefit ratio changes. Back pain. You already know the answer to this. Back pain sufferers just say no. Back pain is almost always getting cleared up on its own. I know it's hard to believe, especially if you're in pain. The vast majority of back pain is gone within a month, no matter what you do to treat it. So say no to an X-ray or CT scan if your doctor suspects nerve damage or cancer, something really serious. Get an MRI, not an X-ray or a CT scan. You have a pain in your gut, it's not just gas pain. This is like a really sharp pain. Or you have a pain in your flank. Is it appendicitis? Is it kidney stones? Those pains are bad, and your doctor is going to say, how about a CT scan to see what's going on? But in both cases, an ultrasound is probably a better option. Just say no to a CT scan to look, to see if that pain is a kidney stone, if that pain is appendicitis or something else. Colon cancer screening? There are doctors who are now recommending CT colonoscopies. That is a virtual colonoscopy. Why are they recommending that? Because it allows patients to to avoid having a tube inserted in the colon, but it requires the same pretest prep. And if there's an abnormal result, then a regular colonoscopy has to be done, and CT colonoscopy is not nearly as accurate. But certainly, if you absolutely refuse the colonoscopy, as we said before, it's better than nothing. If you've been diagnosed with prostate cancer, your doctor may suggest a CT scan to see whether the tumor has spread. But there are a lot of ways to tell how aggressive prostate cancer is from many other things. So you might also want to just say no to that CT scan for that, too. Many people automatically receive a chest X-ray to clear them for surgery, and some hospitals even require it. But X-rays rarely find serious problems in low-risk people headed to surgery. Just say no unless you have lung or heart disease or scheduled for a procedure that is going to involve your heart or your lungs. Ask your doctor, is this CT scan necessary? Is there a safer alternative like ultrasound or magnetic resonance images, MRI? The doctor who's going to be doing this, is he credentialed from a radiology facility? Is he accredited by the American College of Radiology? These are important things to know. And remember, if your doctor has invested in a CT scanner or a radiology clinic, there is going to be a lot more likelihood that you don't really need that test. If you have recently had a CT scan, insist that that be used instead. Here are 5 questions developed by a health group a couple of years ago to ask a doctor before you have a CT scan. 1. Will the outcome of this scan change the treatment that I receive? If the answer is no, then that scan is not necessary. 2. Why do you want this particular test, this particular CT scan at this time? 3. Will an MRI or an ultrasound give us the same information? 4. Why are we having another scan done when I just had one done? 5. I want the radiation adjusted for my size and age. 6. I want to know how much radiation my scan actually exposed me to, and I want it written in my medical record. 7. Is this your scanner you're suggesting I use? 8. What are your credentials in terms of scans? And what are the credentials of those who are doing it? It is true that CT scans allow us to see around and behind structures in the body in 3 dimensions with exquisite resolution. They can detect the difference between normal and abnormal tissue about 1,000 times better than a traditional X-ray. And when it's an appropriate exam, the benefit is far, far greater than any risk from the radiation. But if it's not needed, then once again, that benefit to risk ratio changes. Children who undergo CT scans of the head, abdomen, or chest are more likely to develop brain cancer and leukemia over the next 10 years. A dental X-ray is equivalent to about 1 day of natural radiation. A chest X-ray is about 10 days of natural radiation, And a mammogram is about 7 weeks of natural radiation. A regular dose CT scan exposes you to about 2 years worth of natural background radiation, or about 7 millisieverts. The Japanese survivors of the atomic bombs were exposed on the low end to no more than 5 millisieverts. They were exposed to at least 5 millisieverts. Certainly the amount went up. We don't know how much our bodies can handle, but it is cumulative. Dosages are not standardized in terms of radiation for the tests. One hospital or clinic may deliver up to 50 times as much radiation in the scan as another. Older machines are obviously going to have more radiation, and I am glad to see that once again choosingwisely.org is mentioned, and I have not mentioned it in a little while, so let me say that choosingwisely.org is a great place to go to get a lot more information on, do you need that study? Is that radiation safe? Dental x-rays. How many? How often? You know, the dentist is always asking, how about some x-rays? How about some x-rays? My dentist actually says something about x-rays yearly. However, most people can go 24 to 36 months between bite wing x-rays, which show the crowns of the upper and lower teeth and do not expose you to much radiation, and 10 years between full mouth series. I was interested to read that because that's about the schedule I'm on. And I have just let my dentist know things progress slowly in my mouth. You want a full series of x-rays, you're going to get it only every decade. Studies show that doctors themselves underestimate the dangers of x-rays. Healthcare professionals shouldn't have the right to image children or adults unless they can do it safely and appropriately. And that is not happening in this country, says Stephen Svensson, MD, medical director at the Mayo Clinic. There are so many scans that are being done that aren't necessary, and so many machines that are emitting the wrong dose of radiation. At this point, the risks when it comes to CT scans are almost always going to outweigh the benefits. Remember that radiation causes cancer, and cancers from medical radiation can take anywhere from 5 to 60 years to develop. A 2013 Australian study that looked at more than 6,800 people who had CT scans as children and compared them with 10 million children who did not have a CT scan, found that for every 10,000 young people scanned, 45 developed cancer over the next 10 years, as compared with 39 developing cancer for the people who were not screened. Overall, the children who were scanned had a 24% increase in cancer risk, and each additional scan boosted the risk of cancer by an additional 16%. Children who had a CT scan before the age of 5 had a 35% spike in their cancer risk. Researchers estimate that for every 1,000 children who have a CT scan, 1 will develop cancer as a result. And a 2012 study that looked at 180,000 British children found that CT scans were strongly linked to higher rates of leukemia and breast cancer in children who had received them. We're not ever going to say we don't want to use X-rays. And now CT scans and X-ray procedures like mammograms and bone density, DEXA scans are with us. But we can protect ourselves. We can protect ourselves by saying no and by knowing when these tests might be useful. Radiation exposure from CT scans is vastly higher and far more dangerous than most people realize. As many as 30,000 cancers a year will be caused by the CT we are currently doing. A wide variety of nutrients can protect us against radiation. Common foods and herbs are really excellent at helping protect us when we have been exposed to any kind of radiation. And in fact, there are some things that we can even take beforehand to help ourselves. Next week, we will get into that. For this week, I want to remind us all that herbal medicine is people's medicine. It's the medicine that grows right outside your door. Thank you so much, Gemini, for giving me the time and the space to speak about these issues that are so near to my heart. I want to see people enjoying abundant, optimum health. I hope that the work that we are all doing here to bring this information out to people helps people know when to say no to high-tech medicine and when to say thank you to high-tech medicine. I'll be back next week with a special show on the foods and herbs that help protect us both before and after exposure to radiation. And then, of course, next month, we are going to look at tests that don't deal with radiation, such as sonograms and oscopies, and some do-it-yourself tests. Then we'll probably get into looking at what goes on in hospitals and the ultimate break and enter, surgery. How do we protect ourselves? Once again, there are a great many things that we can do both before and after surgery to help ourselves to heal. And this is the territory that we are going to be exploring in the coming weeks right here at Time Monk Radio. Dream blessings, Gemini.
Thank you so much, Susan. It's always our pleasure to host you here at Time Monk Radio. We always learn so much. And this concludes part 84 of our series, The 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio.